everyone knows what the vagus nerve is, and partly thanks to the work that you're doing and the work that others are doing to help people understand the importance of regulating the nervous system.
As we continue coursing down, the nerve goes down into the chest alongside the esophagus. The two sides will come together and then they'll send branches out directly to the heart and to the lungs.
The dysfunction in their body ties back to the system, and both of us being trained, traditionally as chiropractors, we've always understood the benefit of having a healthy nervous system.
I was really interested in how the body works. It really was this unique thing that I was interested in, but I never applied that to myself, which was really, I think, the missing point and the struggle that I needed to overcome.
People eat the same amount of food and they're hungry like 20 minutes later, and you're just like, and of course they're eating the right proportions of their macros and everything, but they're just not full. They're hungry all the time. And this really helps explain that. Hey, Navaz, how you doing today, my friend?
I'm great. How are you, Sach?
I'm awesome. Great to see you again, as always. And I'm really enjoying following you online, seeing the amazing work that you're doing, traveling all over the world, educating practitioners about the vagus nerve and the nervous system. It's been awesome to see you grow and expand this message into as many hearts and homes as you possibly can. And I love that you're also educating practitioners. So it brings me great joy to introduce you to our community. Some people, I hope, are familiar with the work that you're doing. But for those that aren't, I would love for you to share, perhaps, if you may, tell us a little bit more about you, where your journey started, and the work that you're doing right now.
Yeah, absolutely. So you know my story, but I will definitely share it as short as I possibly can. The story really begins, I was always interested in the brain. I remember in grade 12, OAC biology for those in Ontario, uh, and I'm really dating myself here, but I was really interested in how the body works. It really was this unique thing that I was interested in, but I never applied that to myself, which was really, I think, the missing point and the struggle that I needed to overcome in my own health. And as I continued through my education journey, I decided I was going to go to chiropractic college. And while I was at chiropractic college and learning all about how to be healthy or how to help my patients be healthy, I was suffering from my own health struggles. So my weight got up to around 250 pounds. I was dealing with high blood pressure, borderline diabetes. The gym was just off limits. Like I could not mentally wrap my head around being truly healthy. I didn't understand what health meant. And I share this all the time with all the podcasts that I do and a good chunk of the talks that I give, that there was a very important moment. There were two very important moments that really stick out. The first was my first anniversary. My wife and I were sitting down, we had a wonderful dinner, and we were talking about what the future of us looked like. And a big part of that was we wanted to bring kids into our family, into our fold.
Mm.
But both of us at that time were struggling with health issues, and more me. And the decision was made at that point to make some real tangible changes to our health, because we knew that our kids were going to get our genetics, but we knew that it wasn't a genetic reason for why I was dealing with health issues. It was a responsibility issue. It was a choice issue, and it was being conscious of the choices that needed to be made. And so we made that conscious choice to learn how to live healthier lives so that we could pass on positive experiences and positive knowledge to our children so that they wouldn't experience the same health issues that we were going to, our future children at that point. It was in, I believe, 2015 where I was, and this is the second moment that really sticks out. And you and I met in a very chance, wonderful encounter where you walked into a chiropractic clinic that I was working at in a very rare moment where I was standing in a spot where I'm never standing, just so happened. And you walked in, and it was to get some treatment, obviously, for Deepa. And the conversation ran into that you were a chiropractor, but you decided, or you were not practicing chiropractic anymore in its traditional form. and that you were doing functional medicine. I said, "What in the world is functional medicine?" And I remember running out of the clinic behind you to ask you, "What is functional medicine?" And you were very gracious with your time. You shared what functional medicine was. We met at the coffee shop nearby a few mornings at 7 a.m. I remember you being very, very generous with your time. And you were the one who taught me what health meant and what it meant to be healthy. And I think that was the single biggest light bulb moment for me that turned my health around. I'm kind of having these fun little goosebumps pop up because that
Me
moment
too.
really did stick out to me, and it does all the time. I'm constantly thinking about that moment or running back to that moment because anytime I have a moment where I don't feel like I know I'm on the right track and something's off with my health, I'll always go back to that moment, and it always sticks out. So thank you for being there for that.
Well, thank you. I'm almost tearing up, to be quite honest, because when Deepa got into that car accident, it was quite unfortunate. And of course, for any clinicians listening to this, it's impossible to treat your spouse. You just know how that goes. And not that I really wanted to, because with auto claims and things like that, it's a whole thing. But we'll leave it at that. And I still remember that day when I walked in to make an appointment, because it was weird making a chiropractic appointment for my wife, being a
Yeah.
chiropractor. And normally I don't pull that card, but for whatever reason I even mentioned that. And again, for whatever reason, and by the grace of God and our a wonderful creator, you were there at that time, and it just happened to be that it piqued your curiosity, which I think is also important for people to know about you. Is you're very humble. You were valedictorian of your chiropractic class. I want to mention that. And you have always had a very keen sense of curiosity. And I think that's led to, your ongoing success and the fact that you're now educating and training other practitioners. So it's amazing how, like, one chance encounter, one accident, and then a chance encounter, and then, of course, several meetings after that can have such an amazing impact. So I'm grateful, not that that happened, that Deepa got into the accident, but I'm grateful that our paths crossed as a result of that. And it's, you just never know where life takes us. And it's so beautiful to see where it's taken you. And, with that being said, I know the work that you do now is mainly focused on, if obviously you help people individually, but the work that you do in educating practitioners, and the book that you wrote is about the vagus nerve, which many years ago started catching, a lot of wind and popularity. And now it's like everyone knows what the vagus nerve is, and partly thanks to the work that you're doing and the work that, others are doing to help people understand the importance of regulating the nervous system. So, I'd love to jump right in, because I know there's so much to cover,
Let's do it.
and I know you have a lot to share. So I want to make sure we unpack as much as we can. So let's start off by, just with an operational definition, because many people listening to this, they're, prospective functional medicine patients or clients. They're people who are perhaps in our programs or in programs like yours that are looking to improve and optimize their health, but they don't always know the nomenclature. They don't know what things are called. They just know how they feel, but
Yeah.
they don't know why they feel that way. And many of the ways that people feel and the dysfunction in their body ties back to their nervous system. And both of us being trained, traditionally as chiropractors, we've always understood the benefit of having a healthy nervous system, but we didn't learn much about the vagus nerve except its anatomy. We didn't really learn about how important it was in our overall health and wellness. And that's something that both you and I have learned, postgraduately, because more and more information is coming out about the nerve. And like most things, right? We didn't learn about the microbiome in school. We learned about the anatomy and physiology of the gut, but we didn't learn about the microbiome, and we didn't learn about how the microbiome and the brain are connected, and all these intricacies of how different systems in the body are connected. And they're mainly connected through the nervous system, and the vagus nerve is one of them. So why don't you paint us a picture of what the vagus nerve is, where it's located, what its function is, and why we need to make sure we're taking good care of it.
Love it. We'll start off by why it's called the vagus nerve in the first place. And in fact, there's two of them. We have two vagus nerves, one on the right, one on the left, but we've just done this fun thing of naming it down to a single nerve, the
Mhm.
vagus nerve. The two do come together. That happens in the thorax and the chest area. But we'll get to that. The naming convention is unique because, from an anatomical standpoint, the vagus nerves are the only nerves that go to virtually every single organ in the visceral body, in the chest, in the abdomen. When anatomists were rolling through and trying to figure out what this nerve did, it felt to them quite vague. They were unsure what it was doing. And that's literally why it was then named the vagus nerve. So it's a very unique naming convention that needs to be brought up. I
Mhm.
think it also is very important to note that vague also means unclear in regards to function. And I think that is something that we can now say clarity is showing up. We're getting more clear. We're becoming more aware of what the nerve is certainly trying to do. And over the last couple of decades, it's become this unique piece in understanding how health is created. So we'll get to that. So anatomically, it is the 10th cranial nerve. We have 12 pairs of cranial nerves that come out of the brainstem. 11 of those 12 nerves stay in the head and neck area. Optic nerve, the facial nerve, there's 11 of them that stay in the head and neck. The vagus nerve is the 10th, and it does have a couple of branches in the head and neck area, but the vast majority of it actually comes down into the neck and courses alongside the carotid artery and the jugular vein. So if you were to just find your pulse in your neck, you're actually finding within a couple of millimeters your vagus nerve. You're very close to it. Okay. So that's an important thing to note. It's in the neck and it's beside the carotid artery and the jugular vein, literally in the same tissue, the sheath that contains the blood vessels that bring blood to and from the brain. The vagus nerve is the only other structure located in that sheath called the
Hmm.
carotid sheath.
No coincidence, right?
Exactly. And I think that was what clued me into just how important this nerve is. Why is this the only nerve that's in this tissue, not in the spine, not along the sympathetic chain or in some other area? And it's not in the brain only, it's a very unique spot. So that really clued me into it. As we continue coursing down, the nerve goes down into the chest alongside the esophagus. The two sides will come together and then they'll send branches out directly to the heart and to the lungs. So both of the major organs in the chest area have direct innervation. In fact, when we're children as well, when we're young, the thymus as well has an innervation through the vagus nerve as well. So the thymus is your primary immune system organ that's located in your chest, but that, as we age, starts to shrink down because we don't need it as much. We can almost call the thymus the school for the immune system. And that's another thing that should clue us into what the function of the vagus nerve is. So we'll get into that soon. As the vagus nerve continues to course down, it goes down past the diaphragm. It doesn't innervate the diaphragm, but the diaphragm comes in very important when it comes to utilizing and creating function within the vagus nerve. We'll get into the importance of breath, and that's really where the diaphragm comes in. But it continues on down into the abdomen where it connects to virtually every single organ in there. The stomach, small intestine, large intestine, gallbladder, liver, pancreas, kidneys, you name it. Essentially, every single organ has a direct physical connection from the vagus nerve to it and up as well.
Is
Now,
it just for clarity? Is it also connected to the reproductive organs as well?
it is not directly linked to the reproductive organs. There are other parasympathetic nerves that come out from the spinal cord that go to the reproductive organs, but there is a strong link, and we'll talk about that parasympathetic function as part of this.
Awesome.
So
Thank you. Keep
when,
going.
so when it comes to the function of these nerves, and we look at the anatomy a little bit deeper, you'll note that 80% of the information on the vagus nerve is actually coming from the organs going up to the brain. These are called afferent signals. These are the signals telling the brain what's happening in each of these organs. So these are the status updates. What's happening with the gut? What's happening with the pancreas? What's happening with the liver? We always need to know what's going on so that the brain can make a good coordinated decision as to what to do next or how to respond to any stimulus that's occurring within any of these organs. Vagus nerve is really important in getting that information up. Only about 15% of the information on the vagus nerve comes down from the brain to those organs. Okay, so that regulating information that goes down through this nerve only makes up not even 1/5 of the information that's passed on this nerve, but that information is very important. That's what we know as what's called the rest and digest information. This is the parasympathetic nervous system. When we think of the things that are happening in our body that we don't consciously need to think about, but they're constantly being regulated, these are what's called autonomic functions. There's an autonomic aspect to this nervous system. And there's two branches to this autonomic function. One is that rest and digest, which is the parasympathetic nervous system, which runs primarily through the vagus nerve, but also through some splenic nerves that are the ones that connect to the reproductive organs. On the opposite side of this, we have the sympathetic nervous system inside that autonomic branch, which is what we know as the fight or flight system. So we have to be able to shift between fight and flight when there's a threat to our survival, when there's something we have to push towards, some sort of goal or some sort of stressor. That's when the sympathetics are turned on. But we need to be able to shift over to the parasympathetic, rest, digest, and I've added recover piece because recovery and healing can only happen when this nerve is turned on. We cannot heal when we're stuck in a sympathetic fight or flight state. So this is an important piece of information to note. If vagus nerve is dysfunctional, if it's broken down, if it's not working, if it's been cut, if it's been damaged, or if there are certain stressors that have caused it to break down in functionality, then the amount of signaling that we're capable of putting down that parasympathetic rest, digest, recovery system is significantly decreased. Essentially, if the vagus nerve is hurt, we cannot heal.
Mm.
That is key. And so understanding how the vagus nerve has broken down in the first place, what are the root causes that created challenge or excess stress for that vagus nerve to do the work, that's an important piece. And then what are the exercises? What are the tools? What are the things that we can actively engage to get the vagus nerve working better? I love putting those two together. So understanding that anatomically and physiologically really helps to provide some context on what to do about it.
Mm. So what are some of those common kind of root causative factors that you see? Yeah, I'm assuming surgeries can impact this. Certainly
Yeah.
there's certain surgeries that are more likely to. And then what are some of the perhaps non-surgical factors that can cause a nerve to become dysfunctional?
For sure. There are four different types of stressors that cause the vagus nerve to break down. Now, stress is not always bad. We have to think of good stress and bad stress, and we need to teach ourselves to be able to handle stress. The four areas of stress that we need to look at are physical stress, in which case something like a surgical trauma to the vagus nerve is going to have an effect. Obviously, you're physically cutting it, it's going to break it down. Vagotomy used to be an actually very common surgery that has now significantly decreased. Just
Mm.
thank God for that. But cutting the vagus nerve in certain what you would call strategic areas would have therapeutic benefit. We're not going to get into what, but that can happen. It can also happen accidentally. Cutting the vagus nerve in the chest area or in the abdomen does happen from time to time. So surgical trauma is one of the physical stressors. We also want to think of movement as a physical piece as well. Are you moving too much or are you not moving enough? What's your life like from a sedentary or movement standpoint? What's happening with regards to exercise? Are you able to push or not? Are you able to get up and walk for a little bit, or do you just have to sit and you just are out of breath? Okay. Physical stress also comes down to how are you breathing? Are you breathing with your chest primarily? Are you using accessory breathing muscles like your traps, your upper back muscles? Or are you using your diaphragm and your belly breathing, which is an ideal form of breath? The physics of that affect the physical stressors that can affect the vagus nerve. The second area is biochemical stressors. And the biochemical stressors are the big ones that functional medicine really puts the light on and says these are potential stressors that can be causing these issues. So microbiome dysbiosis. Maybe you have too little Akkermansia, or you have too much of pathogenic bacteria or something that's present that shouldn't be. So we want to make sure that there's balance there. But then we also need to look at toxins. Are there pesticides and herbicides being sprayed on your food? Probably. So are you choosing organic? What's happening with plastics in your environment? Are you cooking on good, clean cookware that doesn't have PFAS and PFOA on it? right? What's the BPA situation? We're all kind of exposed to this toxic chemical soup
Mm.
generally. So, how much toxin are you exposed to? And secondly, how well are you able to eliminate these toxins from your body? Are you sweating often enough? How's your liver function? Are you able to clear it out? How's your kidney function? Are you able to clear those out? One of the first signs of vagus nerve dysfunction is actually bile salts creating actually gallbladder stones.
Mm.
Gallstones are one of the first things because one of the roles of the vagus nerve is to send a signal to the gallbladder to pump out the bile from the gallbladder into the small intestine. And what that does is it allows for release of toxins via the bile, allows the bile to kill off any bacteria that shouldn't be there in some form, and it allows for fats to actually be absorbed into the body because bile salts attach to fats, nutritional fats. So we bring them in effectively. Bile is really important, but if you can't pump it out because you don't have signaling going to the gallbladder effectively, then the bile will actually crystallize and create these bile salts. And those salts can get stuck in the little valve that they're running through to get to the small intestine. And that can create a huge issue for a lot of people. It's quite painful from what I've heard that gallstones can really suck. And one of the most common surgeries that I've even witnessed a bunch of these is laparoscopic cholecystectomy, gallbladder removal.
Mm-hmm.
You know, that's unfortunately the conventional system tends to say if it's not working or it's causing you pain, let's take it out. There's a reason it's there, right? And so, not just saying that your gallbladder had stones in it, they didn't just develop, something caused it to develop. There was likely vagus nerve dysfunction. So, from a biochemical standpoint, your ability to eliminate toxins comes down to that. And if you don't have a good vagus nerve signal, then you're not able to eliminate those toxins effectively.
So detox very closely correlated to vagus nerve
Massive,
dysfunction. Um,
massive.
what are perhaps for somebody who's listening to this who may not have who may have gallstones but not know it because they're crystallized in their gallbladder, or maybe is looking for early signs of gallbladder dysfunction? Is there anything that they should be paying attention to? Certain, dietary responses or something they can test for or look for in their stool to see
Yeah,
if there's early signs of gallbladder issues?
the stool is definitely where you want to look. You want to take a look at what's happening with regards to your bowel movements. If you've ever seen the Bristol school stool chart, Bristol school stool chart, my goodness, I'm going to get that right one of these days. It's there's seven types of stool that you should be looking at, and this is like a no cost thing for anybody. If you want to go and see what's going on, just go and see. Are you type 1, type 2, type 3, 4, 5, 6, 7? You want to be ideally, I believe, in the type 3 and 4 area, which is where your stools are kind of these normalized, longer, elongated, not quite liquid, not quite solid, somewhere in the middle type of stools that you're looking at. Anywhere off of this is often going to be correlated to some sort of digestive dysfunction. Not always gallbladder, but important to note that because detox doesn't just come down to gallbladder, it also comes down to microbiome. And so looking at the stools is a no cost way of identifying is there something that is wrong? Secondly, what's the frequency? How often are you going to the bathroom? We've found that bowel movements happening 1 or 2 times a day is ideal, and more than 3 times or less than 1 time per day is a problem as well. So
Mhm.
keep those two pieces in mind. If you notice anything off on that or on the Bristol stool chart, then you know that something is inconsistent and you need to then maybe dig a little bit deeper or create some changes. If you already know that dietarily something is causing you to go into a type 1 or type 2 stool, then eliminate that because that is probably causing some problems. So be aware of that, but look specifically at those markers in your stool because it doesn't cost anything to do that. Okay.
Okay, wonderful. So, like other signs of gallbladder dysfunction could be or tan colored stools.
Yes, yes.
So, if your stool has a color of a cardboard box, that means you're probably not secreting enough bile. Bile is what gives our stool that darker color. If your stomach is upset or your bowels are upset by eating fatty meals, hopefully you're not eating fried foods, but if you do and that upsets your stomach, then that could be a sign of dysfunctional gallbladder. And then also, one of the things that's interesting is the most common GI symptom associated to stress is constipation. You
Yes.
would think it's diarrhea, but it's actually constipation. About 34% of people who complain about digestive issues have constipation. And so the gallbladder, as you mentioned, bile helps with peristalsis. So it helps with
Yes.
the rhythmic movement of the digestive system to move things through us. And if we're not secreting adequate amounts of bile, then constipation is much more likely to occur. In fact, in our program, when people start eating healthy, and they cut out the fats in their diet, right? Because one of the other things that high fats diets do is it increase leaky gut syndrome. So when we reduce and go to a no added fat diet for a therapeutic window of time, people become constipated. And they think that the program is constipating them, but what's actually constipating them is a dysfunctional gallbladder and poor bowel motility because they're probably stuck in fight or flight and have poor tone in these areas. So
Yeah.
I think you're helping hopefully our listeners connect a lot of dots as to why they might experience the symptoms that they are. And you know, a lot of times when people eat clean and they experience constipation, it's not the diet that's the problem, it's the organs that were not functioning optimally to begin with. That's the actual root cause of the issue. So if somebody does have a dysfunctional gallbladder, perhaps yes, we want to improve vagal tone, and we want to make sure that that nerve is getting optimized. And certainly, we're going to talk about that as we go on this conversation. But what are some other things that people can do that you found work at getting that gallbladder working a little bit better again?
Yeah, I like starting a meal with a little bit of water, lemon, salt. Get the gut started, get things
Mm,
moving. Take a moment, and one of my favorite things, and I think you're a big proponent of this, is let's do some breathing exercises prior to your meal. Let's do something that stimulates the gut to get functioning well and shifts us out of that fight or flight state into a rest, digest, recover state. We're never going to have a direct electrical signal that we can push directly to the gallbladder. But we're going to have vagus nerve signals that can turn on very effectively. And when we actively and consciously make a switch to that rest, digest, and recover state, digest being the key word when it comes to gut health, we initiate this digestive process before the food even shows up,
mm,
right? Before the food is even cooked. It initiates that process and lets your gut begin that motion of peristalsis, which you mentioned. Peristalsis is the movement of food unidirectionally from oral to anal through the gut in an effective manner. And it's a contraction relaxation, allowing the food to move in one direction. The vagus nerve coordinates that, but it's run through the enteric nervous system. And what this tells us is the vagus nerve is the gut to brain connection. The ability to send signals between the gut and the brain is through the vagus nerve directly. Those are the fastest signals that we're going to get. So we need to have these signals where we're pumping through. The other really big thing here, and I think this will link very well to the Living Light program, is GLP-1, right? We've all heard of these GLP-1, GIP, incretin hormones, uh, CCK, PYY. These are all of these hormones that show up in the gut to initiate satiety, the feeling of being full. That signal is passed through the vagus nerve. The signal of GLP-1 turning on these afferent signals in the vagus nerve and going up to the brain is what then signals satiety reflex. If you don't feel satiated, it's likely not just a decreased level of GLP-1, it's likely decreased vagus nerve tone. You're not able to get those signals up quick enough, which is why you continue to eat or you have these issues. This is where satiety reflex comes in. So unfortunately, again, conventional system has come in and said, let's just throw in the massive dose of GLP-1 that we could possibly do, or GIP, and make people feel so satiated that they then feel nauseous, sadly,
mm,
and have this effect. But it comes down to your vagus nerve just isn't signaling effectively. You don't have the signals coming through as effectively as you would want. So that's an important piece to this puzzle as well. It's not just the hormones in the gut. The vagus nerve needs to be addressed. So if anybody's going through a metabolic reset, as they are when they're working with you, they really want to focus on getting the vagus nerve working really well. because even if you are using these medications, you can lower the dose. Or if you've chosen not to use these medications, you can get those signals working more effectively if you have a good functioning vagus nerve, period.
Yeah, I love that. Thanks for building that bridge for us because it's so fascinating. When I go through the metabolic program, it's so much food for me. And I'm like, oh my God, how am I going to finish all of this? And then other people eat the same amount of food and they're hungry like 20 minutes later. And you're just like, are you eating like, and of course, they're eating the right proportions of their macros and everything, but they're just not full. They're hungry all the time. And this really helps explain that it's probably not the food that's the problem. It's the message that's not being properly or adequately conveyed from the gut to the brain to signal satiety. And of course, just like most things, with pharmaceuticals, we just hit it with a hammer, and that doesn't actually fix the problem, right? Because that's just one part of the signaling process that the vagus nerve takes care of. So the real problem is the dysfunctional vagus nerve, which I'm sure you'll help us understand this better. Is it it's not fixing the vagus nerve by giving people high doses of GLP-1, right? It's just
Oh,
yelling the message instead of being able to whisper the message and get it up to the brain. And so by
yeah,
just doing that and not fixing the vagus nerve dysfunction, people aren't getting the other benefits, the global benefits of what a healthy vagus nerve can do for you.
that's exactly right. And if we just target it in that way, then we're not really addressing that root cause. We're not really addressing that common path that all of this runs through. And you've kind of touched on something. You mentioned that 20 minutes later, people still feel hungry. It may not be the same hunger. I think that's a unique piece here. It may be that there's stress and they're stress eating. And people, we've kind of heard about this. What does this really mean? Or why would you eat out of stress? It's a reaction that's occurring because stress, as we talk about it, psychological stress and emotional stress are the two other types of stress that break down the vagus nerve. And when we have moments of, day-to-day stressors that kind of knock us down, a little bit of emotional challenges that pop up. These are the kids weren't listening to me, looking at my bank account is not looking the way I want it to, or somebody cut me off in traffic. These are the day-to-day little chipping away at us stressors that can knock down vagus nerve function. And occasionally we'll try to fill that as those emotional stressors as void fillers, and the quote unquote hunger that we feel is just filling that gap or filling that hole.
Mm.
That's not an ideal situation. Obviously, if you're filling an emotional hole with a biochemical food, you're going to have negative consequences. So be conscious of that. Become aware that maybe there's an emotional aspect to why you are feeling quote unquote hungry, but it's not true hunger. You're just hungering for emotional support or emotional fullness.
Yeah, one thing that happens, and maybe there's a connection here too. I'd love for you to unpack it if there is. But a lot of times when we were stressed out as children, our parents would soothe us with food, right? That would
Yes.
be the thing that would get us to stop crying, or the way our parents would, or mom usually, in my case at least, would express their love and compassion towards us was by making us our favorite meal or feeding us in some way. And I wonder, like, and I'm just thinking out loud here, but I'm wondering if the act of eating is a way for us to unconsciously shift into a more parasympathetic state without realizing that we're doing that. And if we can find another way to do that, perhaps by tonifying our vagus nerve or vagal exercises or stimulation of the vagus nerve, if it would have a similar effect to shift us into the state that we want to feel in. Because I think when people eat, sometimes they eat to nourish their bodies, and sometimes they eat to feel a certain way. But if we can feel that same way through a different pathway that isn't packing on weight or stressing our digestive system out or our immune system out when we're doing it, I think that would be a smarter approach. So what say you to that?
I think you're exactly on track here, and I've kind of had a light bulb moment, which is kind of cool. The So on this particular aspect, when we were children, acutely in that moment, there was some sort of emotional experience that we were going through, and we were being soothed using food. what essentially happened was we built a neuroplastic channel in which food helped to cover or dampen the emotional experience that we were going through, the severity of that. And a lot of what happens is emotional dysregulation is directly linked to nervous system dysregulation. Emotions actually are the thing that we want to learn to not necessarily control, but to experience and then learn how to pull it back from. And when we were children, and this was the practice that was given to us, food was a tool we were used to calm us down, to get our emotions back to a regulated level, to the point where each of us has foods that we consider what we call comfort foods, right? Things that we use to comfort us. And comfort foods are things that we'll always go back to. Oh, I was really craving this experience, or I was really craving this particular food because it's so comforting. And when you
Mm.
think comfort food, you don't think healthy food generally. The food is generally very high caloric, generally very preservative filled, processed food, right? In general. Not always, but that's the majority of the time. You're not thinking of cut up broccoli and carrots near you. You're thinking of macaroni and cheese, or you're thinking something that was given to you with a generally high caloric intake. And that was a trained response. We actually learned that. And that's what created these moments of psychological stressors or psychological neuroplastic creations that then initiated what's called a psychological stressor, which is the fourth type of stress, which is going to affect the vagus nerve in a negative way. And that psychological stress is one that has been explored significantly by Dr. Stephen Porges and the polyvagal theory. And
Mhm.
this is, I think, a great kind of segue into this conversation because those emotions that we were feeling that were regulated by food in those instances, but also through other ways of regulating those emotions, those were moments of feeling unsafe in some way. Unsafe to speak your mind, unsafe to physically be in a specific environment. Safety is the driver from a psychological standpoint that drives the vagus nerve. If you don't feel safe, you go into sympathetic state. Safety initiates parasympathetic, rest, digest, recover state. The vagus nerve turns on when you feel safe. And that's key. And so, what you're saying there when we were fed these comfort foods was we are now down regulating that stress response and creating safety feeling through food. That's why we have comfort foods.
Mm. It's all in the name,
It
right?
is. It
All in
really
plain
is.
sight for us to see.
It really is. I remember going through all of these things, and you were showing me the importance of words, what words meant. You were picking out these things, and I've started to become relatively good at that myself, but it was initiated a lot by our conversations that you and I had.
Hmm. Thank you for sharing that. A couple of things that people are probably watching this and wondering, okay, they're perhaps even self-diagnosing that they have a dysfunctional vagus nerve. Besides some of the things that you talked about, maybe you could share a list of signs of vagal dysfunction.
Yeah.
Just to summarize some of the things that you said, and feel free to add to the list. And then maybe we can go into ways to stimulate the vagus nerve, both naturally and perhaps even using tools and devices that can help us as well.
Yeah. So the best way to know if vagus nerve is working or not, let's talk about some of the symptoms, some of the feelings or experiences that people will have. Number one, it's going to be something either gut related or inflammation related. Those are the top two kind of, and it'll interchange between different people. But number one, let's talk about gut health a little bit more. If you have any dysfunction shifting you to needing to go to the bathroom more often or less often, if you have anything that's pushing you towards constipation or diarrhea, that's something you're going to want to absolutely address um, to make sure that your gut is functioning well. And that is probably one of the more common signs of dysfunction in the vagus nerve. Number two, inflammation. Now, inflammation, I'm just going to close this so that it doesn't open up again. Apologize. It's my mom messaging. So, inflammation is something that I think is a little bit misunderstood. Inflammation is a process that is absolutely necessary to our survival as humans on this planet. We need an inflammatory response to be able to address invaders to our health, physical injuries, biochemical injuries, something that our body needs to respond to. The immune system does it, and inflammation is the process it uses to
Mm,
initiate that initial response. But the key thing is, do we have control? Can we control inflammation? And control of inflammation is run through, shockingly, the parasympathetic nervous system and particularly the vagus nerve. The vagus nerve is the controlling link between the brain and the immune system to initiate and downregulate inflammatory control. Okay. To control inflammation, the vagus nerve needs to be turned on. So if you're noticing that you have a difficult time recovering after an exercise, you have difficulty, excess chronic pain in your knees or in your ankles or fingers, these are signs that there's excess inflammatory process going on and you don't have control over that inflammation that is currently happening. Inflammatory control is the key thing here, and we want the vagus nerve to be able to have that effect of controlling inflammation. All right. So those are the top two signs that I'll see. Now, we're lucky, and you were the one that actually got this for us the first time, but we have wearable devices that are actually able to help us see a little bit deeper than just how we feel. Okay. Now, number one is can you take inventory of your body, see what's going on? Where is your body whispering? As we often will feel, there's tightness in the back area, or my neck is a little tight today, something along those lines. Taking an inventory is number one. But when we have access to devices and tools that can help us to identify what's going on, that's beneficial. So wearable health devices are becoming kind of top of my list here as with regards to wonderful tools that can help dig deeper. So you got us our first Aura rings when we were working together at Living Proof, and I've used it for 6.5, 7 years. I believe you have the exact same timeline. And since then, I've been tracking my heart rate variability, my readiness scores, my sleep scores, my deep sleep tracking, all of these wonderful things, my activity levels. And I think having these data points really helps to create objective outcome measures that we can then identify where we stand, why we stand the way we do. And the
mm,
one big outcome measure, the big data point that helps us to know what's happening with the vagus nerve is called heart rate variability, HRV. Now, HRV is not just vagus nerve. It's a balance between the parasympathetic and sympathetic sides to the autonomic nervous system. How capable are you of switching between the fight or flight and the rest, digest, recover state? The higher your HRV, the more capability you have, the more resilience and ease you have with which you can switch between these two sides, okay, between the two sides of the autonomic nervous system. If you have low variability, that's a sign that you're generally more stuck on that fight or flight side of things, more on that sympathetic state. So and that's going to change. HRV fluctuates minute to minute, second to second. When a race car driver is driving, and this has actually been proven, when a race car driver is driving down a straightaway, their HRV is generally very high. But the moment they hit a hairpin turn, their HRV drops immediately. But then they pop back up at the next straightaway. So, how quickly are you able to go back and forth between these two sides, between the parasympathetic rest, digest, recover, and the sympathetic fight or flight? And that's really key here. It's not about is vagus nerve functional, it's do you have resilience to be able to bounce back? Because if you
mm.
have vagus nerve function, then you have resilience. That's the key point here. So HRV is a huge one.
Yeah, I'm curious. One of the questions that comes up with our clients, but even with the practitioners that we coach and train, is they try to compare HRVs from one person to the other. And I don't know how effective that is because I feel like some people are in their low 20s and some people are in their 80s. And when you compare one person to the other, the person who's at 20 looks at the person that they're 80 and thinks they're like an HRV god. And I have to remind people not to compare yourself to somebody else. But maybe you could talk about, what explains the difference between those two and what number should we be tracking for, if any, or are we looking for
Yeah.
trends? Maybe if you could speak to that, that'd be great.
The best way to kind of put this is I get asked, what's a good HRV? Because I have those same things, right? Some of my patients have 20s, some of them are in the 80s. I've even seen a 76-year-old who had an 83 millisecond HRV the other day, and I was like, that's phenomenal.
Hmm.
That said, don't compare with other people. A good HRV is better than yesterday. That's the key thing. Can you, over time, work to increase your personal score? Okay. So HRV is kind of a tracker of where you stand. And what you're looking at with wearable devices generally is an average over the nighttime period. Some devices do 24-hour tracking, some do just nighttime, some do just the moment you're doing the process. So you turn it on to check what your HRV is during that time. It's a very instant moment. So the averages are going to be a little different. And what we're looking at is not necessarily comparing that I'm close to a particular number. We just want to be better than we were yesterday. That's a goal that we should have is just can we track upwards? Okay. Over time, if you can increase that average, that's great. And in fact, don't even compare with other people, don't even compare between yourself and different devices. I have patients that have an Apple Watch and an Aura Ring and a Whoop band, and their HRVs are all different. And it's because they're not measuring the heart rate variability. They're actually measuring pulse rate variability, which is a big deal. We're not actually measuring at the heart, we're measuring at the blood vessel that's going through the finger or through the wrist. Those are important factors. So the blood flow through those areas is always going to be slightly different versus electrical activity that's being measured at the heart through something like a Polar H10 chest strap or something like that. So
Hmm.
don't even compare between devices. Secondarily, the algorithms that they're using, the sensors that they're using, they're all going to be different. So essentially, pick one device, use that device consistently, and don't use it in a diagnostic manner, use it in a trend directional manner. Each of these devices should be only utilized to tell you how are you tracking, in what direction are you going. If you're going down, something is obviously not working right, and the device will help you do that. But if you're trending upwards, then you're on the right track, and that means that your habits and the things that you're choosing to do are affecting you in a positive way, boosting your resilience, and that should be the ultimate goal. Now, when it comes to why some people are in their 20s and some people are at their 80s, and they're generally in the same level of health or same age category, it comes down to a lot of genetic variances, it comes down to training differences in childhood. Did you build it out? What's your VO2 max? There's so many different unique individualizing factors that then create where your individual average is. So never ever compare with anybody else because yes, we all would love to be the most fit, healthiest person ever, but the choices that we made and the genetics that we were given early on actually dictated where we start. So let's not use those as negative factors. Just utilize it as here's where I stand now. Where do I want to go? I want to get better, period.
Yeah, great guidance because it's sometimes easy to compare ourselves, especially between our spouse, right?
Yes.
So, Deepa's HRV is in the mid 100s,
Wow.
and you're just like, and that's the response I have is wow, right? But
Yeah.
now that I'm hearing you say what you're saying, it doesn't necessarily mean that one person is healthier than the other. I just have to stay in my lane, focus on what my number says, and work on improving that, and
Exactly.
just make sure that it's trending in the direction that I want to take my health in. And of course, there's going to be things that throw us off, right? Like travel or late meals or stressful periods in our lives. If you're coming down with something, that's gonna HRV, you're going to see that start to drop, which is a it's kind of cool to see it. It's not cool to be unwell, but it's cool to see how HRV is impacted by, even prior to symptoms, how it can be impacted. So it can give us kind of a window into a preview into what's coming. Now that we've kind of talked about measuring it, I'd love to know what are ways that we can improve our vagal tone and improve the health of our vagus system. Maybe let's start off with maybe you can go head to toe if that's a thing, or you can and we can start off with the free ways, and then maybe
Yeah.
the more kind of ways that we can invest in improving our vagal tone.
Let's start with the freeways. And the way that you and I both are fully aware is the strongest, most powerful, and freest thing that we can do. And that is learning to breathe correctly. The breath is powerful beyond measure. I think that is ultimate here, right? We all take between 16 and 23,000 breaths per day. And if we just put attention to it, for a few minutes every day, you can actually make significant positive changes just simply by utilizing the breath in that very powerful way. I remember the moment I experienced this the first time was I was, and you know him obviously very well, with Giovanni doing elemental rhythm breath work. And I remember he did it for me. I was at a friend's place, and it was a session where he had his guitar, and we were sitting on the deck, and we were looking up at the beautiful. I still remember how blue the sky was, and the clouds were slowly rolling by. And I had just gone through my first elemental rhythm breath work with him. And my body was, I was in my full lobster claws, cramped up, hands were full on, but I felt alive for the first time in a very long time. I felt truly like through 1 hour of learning to breathe, and this is on a monthly, maybe every 6 months basis, you can create such a huge positive shift. So
Mm-hmm.
breath is key. Now, we don't need to go to the point of doing elemental rhythm breath work to have these positive changes. Breath work is key, but we want to learn the first couple of basic free things that we can do. Number one, your breath needs to be three things. You need to breathe through your nose. The nose is the breathing tube. The mouth is the eating tube. We don't have teeth in our nose. We don't have nose hairs in our mouth. We have it built in a particular way. And the other one is a backup plan if we need it, which is great. But the nose is the breathing tube. Breathe through your nose, number one. The nose filters the air through the hairs. The air comes in, it gets humidified, circulated through the sinuses, and comes down to the lungs, then ready to be shifted into the blood vessels for oxygen to come in and for CO2 to come out. So your breath needs to go through your nose. Number two, your breath should be diaphragmatic, meaning that it should not be focused primarily in your chest. When you're trying to be calm, you're trying to bring your breath down to your belly. Diaphragmatic breathing, learning to breathe with your belly. So I have patients do this all the time. I'll have them put one hand on their chest, one hand on their belly, and take 3 breaths and assess, am I moving more with my hand on my chest, or am I moving more with the hand on my belly? And ideally, we can help create that shift utilizing this tangible tool, literally using your hands to feel it so that you're pushing your breath more towards your diaphragm and more belly breathing. Number three, so nasal, diaphragmatic. And number three is we want those breaths to have longer exhales than inhales. So this is really cool. As we breathe in, we're actually creating a shift towards sympathetic state. We're actually turning on the fight or flight system. The experience for this is if there's a loud noise or something sparks your attention, you're immediately going to go take a deep breath in, get ready for action, right? So inhale is the initial reaction to some sort of potential stressor or threat to your survival, something you perceive as not being safe. But as that threat goes away or something challenging has gone from your sight and you feel safe, what's the first thing you do? You go, and you take a sigh of relief. As we inhale, we're turning on the sympathetics. As we exhale, we're turning on the parasympathetics and the vagus nerve. So shorter inhale, longer exhale. So I'm a big fan of doing initially to start these things off. Box breathing is a great way to get started. 4 second in, 4 second hold, 4 seconds out, 4 second hold. But then we want to lengthen out the exhale over time. Big fan of 4-7-8 breathing, which is 4 seconds in, 7 second hold, 8 seconds out. And that pattern, that 4-7-8 triangular pattern, has been beneficial for hundreds and hundreds of patients that have been able to create that shift just simply using their breath and doing between 3 and 10 breaths of that pattern, 4-7-8, can really help shift you towards that parasympathetic state far more readily. The breath is key. Everything begins and ends with the breath, and all of the other exercises, all of the other habits and tools that we can plug in all revolve around affecting the breath in some way.
Amazing. What else can people do?
So, adding on to that, now if you've learned to breathe and breathing has become relatively easy and you can do that 4-7-8 breath without any issue, then let's train ourselves to handle those stressors that we might experience in a positive way by being able to shift to parasympathetic even when the stressors are present. So, cold. Cold is a wonderful way, or even just temperature changes. We tend to live in a very, room temperature all the time. between 19 and 24 degrees Celsius. For the Americans, we're talking kind of 65 to 75 degrees Fahrenheit, somewhere in there. And that's comfortable, right? But we tend to not go out of that zone very often. So cold or hot can be very beneficial in helping you to experience a different temperature and change your breath pattern consciously while you're in that pattern. So this can be done with sauna. This can be going outdoors in the sun and getting some sunlight, but also experiencing the warmth of the sun and creating a temperature shift internally. Or it can be done with cold showers, right? Having cold hit you on the back of your neck is an immediate stressor. Your body goes into this stress reaction, and you can teach yourself to breathe out of it and have that calming diaphragmatic breath occur through that, to the point where if you want to go into a cold plunge or an ice bath, those are phenomenal tools for people that can handle it. If you have Raynaud's phenomenon or anything like that, please do not go down that path. But you want to be really conscious of putting yourself into stressful environments that are controllable, that you can manage your breath within those moments. So learning to breathe while under stress. So temperature is huge. Another great, awesome stressor, one that I'm actually doing currently as we speak right now, is fasting. I'm a huge fan of fasting. I did my first 72 hours with you. I now do 72 hours on a monthly basis, and I'm currently on, I want to say, around hour 68 right now.
Nice.
Something along those lines. Let's pull it up. 68 hours and 51 minutes
Oh, good for you.
currently stands. So I'm going to finish up 72 hours tonight at dinner, which is exciting. Fasting is stressful, right? Fasting is stressful because your body is not getting a lot of the nutrients in that it needs. It's not taking in the nutrients to help with resorption, but it's also incredibly beneficial for your gut. It's giving your gut a break. Digestion
Mm.
is a very energy intensive process. Giving your gut a break gives it a moment to not go into digest state, but to go into rest and recover state. And rest and recover is where healing actually occurs. I'm a huge fan of fasting. It doesn't need to be 72 hours. It doesn't need to be anything extreme. But giving your body a break from consumption constantly has a massive effect on shifting towards positive HRV and vagus nerve activation, because you're helping your body along on its recovery process.
Yeah, first of all, congratulations, because that's not an easy thing to do. And one of the things about fasting, and even in our metabolic program, we encourage intermittent fasting, and we also encourage no snacking. See, a lot of programs encourage you to snack. So you're like constantly eating, there's constantly food going into your belly, which means it may not be in your stomach, but it's in your digestive tract. And then your vagus nerve is kind of working overtime. Your immune system, digestive system is working overtime, and it never really quite gets a break. So it sounds like it's better to eat in, maybe 2 or 3 square meals a day versus constantly snacking in between. And periodically, maybe it's once a month, you do a 24 to 72 hour fast. Some people I know do a 24-hour fast once a week.
Yeah.
So find, the cadence that works for your individual schedule. But, fasting is, so powerful in so many ways. And just, I'm curious what your thoughts are on like a fasting mimicking diet where you're still eating a little bit of food. Would that have the same benefits on the vagus nerve as just a water fast?
I think it would have some of the same benefits. A fasting mimicking diet is a great option for sure, especially for people that are more at the beginning stages of going into a fasted state or trying to learn how to do fasting. Because if it is stressful for you to do a fast and you haven't learned or trained yourself to be able to do it, then 72 hours sounds incredibly daunting, right?
Mm-hmm.
Versus somebody who's been able to do it or has trained to do it, it's not stressful. In fact, I can't even explain to you. We're at almost 69 hours since I've eaten something, and I feel mentally and cognitively more capable right now than in the 3 to 6 hours after I eat a meal, right?
Yeah.
I feel sharp. I feel clear. I can make decisions. I'm conscious of what I'm trying to say, and I feel more aware. It comes down to the idea that this is an adaptive process for me to go and try to find food, but I'm trying to hone my cognition during this as well. So the reason I like it, and from a more philosophical standpoint, we'll go in that philosophical pattern right now. We're cyclic creatures, everything that we do has adapted to being in a cycled experience in nature, right? We have day and night. We have seasonality when it comes to the cycles. We
Mm,
have cyclic nature of hormone patterns through the day, through the night. We have cyclic patterns of hormones through the month for females. We have cyclic patterns of even hormones through the day with testosterone being higher at certain times and lower at other times, right? We are cyclic beings. And what that means is we need to actually cycle our consumption as well. And when we cycle consumption, that means are we taking in or are we pausing? Are we in consumption or are we in recovery mode? And I think that's where fasting has, why it's become um, entwined with every single religion, has some sort of fasting process within it. Why? It's not necessarily for a religious specific purpose. Maybe there's something more physiological behind it. Maybe it's I'm giving my brain and my body a break from doing something that is constant overconsumption.
yeah. I think another, kind of staying in that same spiritual vein, our body's a temple.
Yes.
And when the temple's full of crap, it's not a temple, right? So by fasting, we're not allowing anything foreign into our body for an extended period of time. We're eliminating, all the waste that we've accumulated. And it can be quite metaphoric as well, right? It's almost like a form of rebirth because when we're born, our bowel is empty. There's no food in there. So it can be a very regenerative process, a very spiritually enlightening process, and maybe moves us closer to our original kind of state that we were born in, where we were closest to God, if you will. So I feel like there's so many benefits to fasting, and of course, one of the many is improving vagal tone and of course reducing inflammation. I know
Yes.
I've I still I'm probably overdue for a 72-hour fast at this point, but I think like I can think back very vividly to being at the point where you're in right now and wondering, should I even eat?
Yeah.
Like, and do I really have to eat? Like,
Yes.
you're just kind of questioning yourself because you feel so good, right? I think day
Yes.
two is probably the hardest,
Yes.
or day minus one is probably the hardest because you're just like trying to talk yourself into it. And then day one is not too bad, and then day two gets a little bit more challenging, and then day three you're like humming along,
Yeah.
and by the end of it you're like, man, that was probably easier than most people might think. And of course, like you said, we don't suggest you start there. Maybe start with a 16-hour, then 24, and then work your way up to 36, and then you can go to 72, whatever you feel called to. But yeah, it's definitely so many benefits. And then I know there's like mechanical ways to stimulate the vagus nerve. Do you want
There
to talk
are.
about those?
So yeah, we'll go back towards a little bit of history. Vagus nerve stimulation was initially, and it wasn't actually vagus nerve stimulation that they knew they were doing, but it started with carotid massage, which was a tool that was utilized by medical practitioners way back when. The issue was when you're massaging physically the carotid artery in the area where you find the pulse, if you push too hard, you can cause people to pass out because you're decreasing blood flow to the brain. They didn't realize when they were doing that, they weren't necessarily just massaging the carotid artery, they were also massaging the vagus nerve. And that was having a very calming, positive effect for a lot of people. Now, we've gotten to the point where we understand that we don't want to physically manipulate it, but tapping is a great way to do that. Mechanically, you can
Mm,
tap on the areas using a couple fingers on both sides, can be very calming. Even just kind of stroking along the carotid artery areas or the carotid sheath can be very calming, and you can kind of sync your breath to that pattern as well. From there, other technologies and tools have been developed. And a big one that I'm a big fan of is electrical vagus nerve stimulation. Now, there is a branch of the vagus nerve that goes to the ear. It goes to the tragus and to skin of the auricle of the ear. It doesn't go to the entirety of the ear. It's a very small branch. There's under 1,000 neuronal fibers from the vagus nerve that go there. But electrical stimulation on the auricular branches has been utilized, and that's something that's actually based on acupuncture.
mm,
Acupuncture, auricular acupuncture, has been around obviously for thousands and thousands of years in traditional Chinese medicine. And there are certain points, particularly Shen Men point, for those who might know a little bit about this, it's known to have a very calming effect on the body. And that's a vagally activating point in the auricular branch. So that's a great spot to get electrical stimulation to go on. And so there are these electrical auricular vagus nerve stimulators, and they're great. I just find that they tend to have a little bit of a longer treatment time and they're a little bit more difficult to plug into your day-to-day life. So they tend to be between 15 and 60 minutes required for the stimulation to occur, for you to then feel that experience of calming down and getting the vagus nerve activated, simply because there's less fibers there. There's now also electrical vagus nerve stimulation that's non-invasive that goes directly on the neck, directly on the carotid sheath area. And these are handheld or not handheld, even just kind of bilateral devices that are great for getting the vagus nerve electrically stimulated. You can utilize electricity to turn on nerves. This is not something that's new. It's been utilized for thousands of years. I actually saw an article today that it was electrical eels were used by ancient Greek and Egyptian people to cure headache, which was
Hmm.
insane, which was a really unique kind of thing that I found out. But electricity is something that stimulates nerves. And electricity is what nerves use to pass signals along them, but we now have these handheld devices. I really like the Truvaga. This is a great device over here. Or I've got my Pulsetto here beside me. These are great devices to get the vagus nerve stimulated, and the treatment time is generally quite low. Now, they're not 100% across the board going to work for everybody, but I do like them because for a lot of people, in 2 minutes of stimulation, you can really calm the body down. And one of the more common things I hear after people start utilizing this is, man, I haven't slept like this in years, or I haven't had this calming sleeping effect since I was a child, or something along
Hmm.
those lines, right? So this is a very common concern that people have is they're not sleeping well. And when you sleep, your vagus nerve turns on at a higher level. In fact, here's a fun little tidbit for everybody. Melatonin, which is what we know as our quote unquote sleep hormone, even though it doesn't have to do with sleep, it has to do with calming to the point where you can enter sleep. What melatonin does is it actually shuts down sympathetic nerve activity. And what that does is that when it has this sympatholytic effect, is it enables the vagus nerve to turn on and have more of a recovery process and a recovery effect. If you're not sleeping well, you're not giving the vagus nerve a chance to turn on.
Hmm.
This is why sleep is so important when you're trying to recover your metabolic activity. This is really kind of a missed piece here that when you sleep well, you recover well, and you turn on vagus nerve function, which then enables the gut to do a better job. It enables the body to recover more effectively, and it controls inflammation far more effectively. So I'm a big fan of these tools because they can help enable that process to occur almost as a catalyst. And then I tie them in with breathing pattern, with humming, chanting, gargling, which are all great physical or vibrational tools that can get vagus nerve activation to occur as well, because there are branches that go to the throat muscles and auricular stimulation. Some people even use things like cotton balls or Q-tips. Don't put the Q-tip in all the way, but just on the auricle of the ear, just mild stimulation can have these effects. And these are relatively low or no cost options to get it working. If you're interested in investing, I'm a big fan of the vagus nerve stimulators. And there are invasive devices that are literally plugged in on the neck, um, which they have their therapeutic benefits, particularly in cases of epilepsy and really, really bad treatment-resistant depression.
Hmm.
So that's where I would put the invasive devices. But I really think that for most people, if the breathing and the humming, chanting, gargling, and other vagus nerve exercises are not enough to get you to the point where you're therapeutically benefiting, that's where these tools can really come in handy.
I love that there's a variety of different options to stimulate the vagus nerve and get it working and functioning optimally. I know that I've heard this. Maybe you can verify this. Is that tongue scraping is also good
Yeah.
for vagal stimulation and gagging yourself.
Yes, the gag
Um,
reflex is absolutely so not the sensory component, but the motor component, the actual gagging, physical gag reflex is absolutely initiated through the vagus nerve. Yeah.
Yeah, so I remember growing up, I would hear my parents would use, and I still use the tongue scraper, and they would just be like making these retching sounds in the bathroom, and I'm like, what is going on in there? And now that's me. I'm making these retching sounds, and my son is like, what is wrong with you? I'm like, I'm stimulating my vagus nerve, dude. Leave me alone,
I
I
love it.
love that. I know you pointed out two devices. Is
Yes.
there any difference? I know that there's differences between the two. Maybe you can point it out for
Yeah.
the people who are watching.
So the True Vega is a one-sided handheld device, which is easy, and it's especially good if somebody has a larger or smaller neck. Um, and I find I really like the handheld piece to this, just because you can adapt the pressure accordingly. You can take it off pretty easily. You do require gel for the electrodes to actually have conductivity through the skin.
Hmm.
If you're having trouble with that, and if you're not feeling it, just a fun little side note, dehydration in your body may be the reason for that because hydration allows for electrical conductivity to occur. So boost up your hydration piece, which may not necessarily just mean water. Electrolytes are very important as well.
Right.
So keep that in mind. So the Truvaga is a one-sided device. I really like that. Only available in the US right now. And then Pulsetto is a two-sided device that you just kind of open up and you put on your neck like so, for those who are watching on video. You can see, and you turn on the device and it runs through a Bluetooth connection to your phone. Um, the issue with this is connection may be an issue if you're not kind of in the middle of neck sizes.
Mm.
So smaller necks may have to hold on while you're doing it, or larger necks you may not fit, which is a bit of an issue. And it can get a little messy as well because when you have gel on these and you're taking it on and off, particularly for those who have long hair, not an issue you and I have, um, then it can cause the gel to go into different areas. There are other devices. So these are direct vagus nerve cervical stimulators. There's things like the Dolphin NeuroStim or the Nuvana that are great for the neck or for the ear, excuse me. And then there are biofeedback devices, things like the Apollo Neuro or the Sensate, which are more vibrational, calming, reminding you to breathe type of tools. So they're catching you in certain moments and they're helping you to focus your breath pattern during those moments. But biofeedback is more of a can you be attentive to this in this moment? And can you re-engage with your breathing pattern to enable that process to occur? So there's lots of different tools and options that are out there. See what resonates with you as an individual if you're deciding to go through this. I've just found the best therapeutic benefits tend to be for the shortest therapeutic time, and the handheld device is my favorite.
Okay, wonderful. Well, man, you've shared a lot of golden nuggets here. So if you're watching this or listening to this, you may have to go back and listen again, take some notes because this can truly, truly change your life in so many ways and certainly improve your metabolic function because as we know, a lot of our, choices that we make in life are directly correlated to the state of our nervous system. And we don't make the best choices when we're in a sympathetic dominant state or when we tend to lean in that direction, but we also don't heal and repair. And for those of you that are in our programs or even Dr. Habib's programs, the key I think is can we get you into the healing state because that's when your body's innate intelligence takes over and then it just works around the clock to repair, regenerate, rejuvenate, restore, and rebuild your body. But you can't heal if you're in a constantly sympathetic dominant state. And all the supplements in the world, all the most advanced lab testing that you might be getting done kind of falls at the mercy of the state of your nervous system. So we've given you a bunch of tools to work on, a bunch of tools to work with. And, one of the most important things that anyone who's watching this can do is pay attention to the state of their nervous system via the vagus nerve. Navaz, I know you've got a bunch of resources that people can access to learn more about the work that you've done. Please share more about your book and where people can find you as well.
So you know this, but I've got two. So we have Activate Your Vagus Nerve, which came out in 2019. It's a very good starter book, great place for people to get started. And then I've got Upgrade Your Vagus Nerve, which talks a little bit more about the use of electrical vagus nerve stimulators and some of the therapeutic cases and case studies that I've found beneficial with my patients, and a lot more kind of clinical experience plugged into the second book, which is Upgrade, which just came out last year.
All right. Well, huge congratulations. I know you've got a podcast as well that you
I
do. And,
do.
and where can people find you online?
It's the Health Upgrade podcast, which I do with my wonderful friend who actually was the inventor of the Truvaga device. His name is JP, wonderful guy. And you can find that anywhere, Apple, Spotify, YouTube. And you'll also be able to find me on Instagram at Dr. Navaz Habib. And I have one fun little resource for anybody who's interested. I have a 10-day vagus nerve jumpstart program. For anybody who's interested, feel free to jump onto vagusnervejumpstart.com and you'll be able to sign up for 10 free daily emails that will get you started with these processes and initiate you into the healing mode so that you can recover.
I love that. Thank you, my friend. I'll be sure to add the links and your handles, and of course, what an honor and pleasure. Love seeing the continuous expansion of your work. I'm so happy that it's hitting the main stage at events and also spreading like wildfire online. Thank you again for your time today, and once again, all the best to you. And if are there any final words that you'd like to say before we jump off here?
No, I think it just comes down to how much I appreciate everything that you and I have experienced together and the growth that we continue to experience. And let's go change more lives. Let's help people live their true lives in the best way they possibly can.
Amazing. What a great way to end our conversation today. Thank you again, Navaz. Great to see you again, my friend. Until we meet again, lots of love and send my best to your family as well.